Again, with my personal journey, I was diagnosed with avascular necrosis in my bilateral hip, and there are many patients who also asked us questions with regards to this. And the only symptom that I remember having was excruciating lower back pain. I don't know if it was lower back or I can't really recall. I was around 17 years then. So and then I couldn't move for a while, and that's when the doctor told us that there are two ways that they usually go forward with this. That there's a surgical intervention, and then there's the intervention that I was given, which was my steroid doses were tapered, and I was almost made to immobilize myself for a couple of months. My walking was limited, my mobility was controlled and limited. So, what is avascular necrosis, doctor? And when is surgery really required? Because as patients, we often have that fear and inhibition. Should we do surgery? There's always that fear. And if it is required, how is it usually done? And is it safe for lupus patients, doctor?
Avascular necrosis in general, we call it AVN by the short form. What happens? It can happen to any bone. Basically, what is happening is the blood supply to the bone is being cut off. The bone is going into a relative period of no or less vascularity. And what happens when you have limited blood supply? When the blood supply is interrupted, the bone tends to there is a destruction of the bone, and it is unable to bear the weight. The commonest and the most frequent area where you get avascular necrosis is the hip, the upper end of your thigh bone, the femoral head. The femur is the Latin term for the thigh, and the femoral head, which is the place where the thigh bone joins, forms the joint with the hip bone. The hip joint, the femoral head, has got even otherwise it has got a very limited blood supply. So in persons with lupus or patients on steroids, avascular necrosis is not just limited to lupus patients. It can happen in a variety of conditions, like people who are on steroids for other things, people who are alcoholics, trauma. All these can precipitate avascular necrosis. But the end stage is basically the blood supply to the femoral head gets cut off. You start getting pain, and that is a major problem, because if this happens in the late stages, like maybe at the age of 50 or 60, the solution is fairly in sight and you can do a joint replacement. But the joint replacement, obviously it's an artificial joint and it doesn't have the ability to repair itself. So an avascular necrosis in a young person, like you people, like in your 20s and 30s, when you get an avascular necrosis, if we would like to delay surgery for some time, if it is possible, and at times if we need to do surgery, we need to understand that these joints have a limited lifespan. So maybe 20 years down the line you might need another revision surgery. But as you said, the first step might be to manage it medically. We'll try to avoid a surgery, and medically you can obviously the simplest thing will be to use what you had experienced. You can limit your activity till the bone heals. You can use a walker or a walking stick. Take the weight of the joint. You can taper your steroids, and then there are medications like bisphosphonates, which has been tried in early stages of avascular necrosis. But once the structural changes occur in the hip, then probably all these non-surgical maneuvers are not particularly great. Once the joint has sort of got damaged, non-medical treatments are not very effective, because an irregular joint surface is a source of pain. So that is the time when we start thinking about other things. There are procedures like core decompression. There are procedures which can spare your joint, something which is in between medical treatment and joint replacement. Things like core decompression. If you read a little bit, there are procedures like core decompression and osteotomies which can probably help you. It may not totally take away that pathology, but still you will get some time. You will be able to delay the joint replacement for some time. That is also possible. But once you have significant changes in the bone, you are symptomatic, you are unable to do your normal activities, joint replacement probably will definitely help you. Joint replacement is obviously a major surgery, but the relief I think it will provide is going to be very good.
Right, doctor. My next question would be on the lines of the quality of life. Since we are the youth and we are either going to college or getting a job or going abroad or getting married or having kids, that's the age bracket. Will a replacement affect the quality of life? While I know that replacement is done to improve the quality of life, will there be restrictions? Because I remember I was restricted for a long while. Even the amount I walked was also restricted. So, will post a joint replacement, whether it's a knee or a hip replacement, that most patients we know go through these two only. Will they be able to continue with day-to-day activities, or will there be severe restrictions?
Your quality of life is definitely going to improve. I mean, you will be able to do most of the things that you love to do, but obviously there will be some restrictions. It may not matter much, but for the normal person, like say squatting, it puts a lot of stress on the hip. Many of us may not want to squat often, but squatting probably puts a lot of stress on the hip and knee and all that. Obviously, you might be able to do that also, but it's important that I think we understand that joint replacement is an artificial joint. Like our human joint, we have the ability to repair, like small injuries, it does repair itself. But an artificial joint has got its own wear properties, like any joint, like a joint in a car or in a machine. It has a wear and tear, so this will happen. So the more you protect it, I mean, doesn't mean that you have to be very restricted, you cannot do anything. No, not really. You will have a pain-free life, but the only thing is we need to understand that eventually these joints will need a revision. Yeah, but that is the main concern for us. Like when we do a joint replacement in a young person, we are really looking at another procedure down the line. But if it is done at something like 60 or 70, probably we'll be able to do with single surgery.
Right, doctor. To one of the questions our patients asked, her name is Yojana. Her question was she had a hip replacement, and her concern was she feels there's a height difference. Now, that was something very new to me. What is that exactly, doctor?
It is possible that there can be some limb length discrepancy, but many a times minor limb length discrepancy can be easily managed. Something like 1 to 2 centimeters is easily compensated by our pelvis itself. You don't really have to do anything. Even little bit more, you can make some minor adjustments in your footwear. A small heel raise might actually help her. But if you have a major problem, it is possible. But nowadays, like in Amrita, we have my area of interest is actually spine, but we have our joint guys here who have robos which can actually calculate plan the whole thing ahead. So I think the issues like length discrepancy is usually much less when you plan it nicely. But obviously there are difficulties. In any surgical procedure, you cannot really predict 100% results. But I'm sure that most of us, like 90-95% of the people, will definitely have good results. But limb length discrepancy, that is what we usually call that length difference. That can be usually managed without much of a problem.